To the Eastern Cape, the coronavirus lockdown provided some shelter for many homeless people in Port Elizabeth as they were housed in safe areas like halls and the like. They were also provided with food, but most of the homeless in Port Elizabeth have returned to the streets, facing the harsh reality of being homeless. According to a recent estimate by the Human Science Research Resource Centre, approximately 200,000 people are homeless in South Africa. Lerato Fekisi is following up on this story. Lerato, very good morning to you. So take us through what's happening where you are.
We actually have been driving around, Blaine, trying to find out from homeless people, are they still in shelters, are they back on the street? And the most of them we talked to were saying that, as tough as COVID-19 was, we wish we could go back to the time when the regulations were not lifted, because back then we had shelter, we had food, we had a refuge, we had other people around us who were fighting the same struggles, because as you know, Blaine, during the time of the regulations being lifted, they were staying in shelters and they were getting food, they were getting good sanitation, stuff they don't actually experience on a daily. So most of them that we spoke to were saying, as crazy as it sounds, I wish we could go back to level 5, because at least then we're guaranteed a plate of food a day. But I bumped into a young man by the name of Mawande Jacobs, who's been staying on the street now for the past year, and I want him to share his story with us of how life has been for him during the coronavirus. Mawande, ngexesha le-COVID netata, ubuhlala phi wena, uya waya kwi-shelters, xa ufika apha wafika imeko injani?
Bisela wena ngoku yabise ngayo yabona sithi cha mina inibona into endiyibonayo mina sekhaya lulonzakalo lodwa likhoyo, kodwa ke abanye akho mntu ufuna uphatha, akho mntu ufuna uzananyani malungana mhlawumbi ngokubona bawemkela ntoni kokwabo okanye kwatsha kwacima, like kukho nto uzakakhumbula ikhaya okanye unento kuyibona into enjani.
Tata, uthe wena ngobesithetha kuqala naye wathi uba ngexesha ufika phaa kwi-shelter nekhange uhlale ixesha elide, kutheni ungahlanga kwi-shelter ngexesha le-COVID?
Okay, no, khange ndihlale, zange ndingene phaa, zange ndahlala phaa.
Sithini isizathu tata?
Otherwise bekugcwele ku-over naphantsi, andifuna ukuxokisela mna sekhaya. Kule ilapha eHoma, kule ilapha ka-8 ndikucela ngayo yabo, even noba unoya wena ube nesiqinisekiso sayo, bayeka belungu apha abantu banenyoka hayi uyaxoka lo mntu lo bengafuna uhlala apha. No, kufuneka uzibonele beka indlela bekugcwele ngayo, even notaroro lo sathe solala phaa ngaka-8 efront kubona, because kugcwele naphantsi zi-white, akho mntu ngekhoyo likhaladi, yi-white, yintoni, singaba singathi nase-visitors kubona. Akho nto kuthiwa kugcwele ndawo zonke, kukho umlungazi okhoyo apho ohamba ngesikuti undihlelele ngeeshelter okubona, uthi ubanjele nohamba esitratweni for nje out of nowhere, ukuyibona into enjeya njengalaa mfana besilwa apha bale ntwana le.
Okay, Mawande, ngoku i-regulations liftiwe ngoku niphinda bele esitratweni, kunjani ubomi ngoku? Awoyiki mhlawumbi ngayifani ye-coronavirus, ukhe wayotesta, kunjani ubomi ngoku xa ubele esitratweni?
Ndiyasithanda le qha like ngaske kaloku izibuyele ezo nto ezophathi nethi uba xa buzobanjela uhambe esitratweni ayikho right loo nto leyo. Andiyiboni. Boyibona njani?
Ingaba ufeelsha safe tata? Ingaba ufeelsha safe apha esitratweni ngexesha le-COVID? Mos abantu bayasuleleleka, nihlala kwiindawo ezincinci, space esincinci. Ngaba ufeelsha safe wena tata apha esitratweni?
No, andifeelishi safe ngokwam. Ngokubona qha ngaske ndizifile kahle ndiyenze le nto ndifunayo kubona ngendlela engayo, because bengakwazi like andithandi like aske mandithi yi-TV mani endibethayo like isound umculo, indawo nomculo akubona apha ndiyazama u-acta ngandlela zonke qha kukenyelwa ngandlela zonke apha, because ku-active apha uyabona kwixesha elithile kufuneka indawo ethile ubambe iposition yakho ngexesha elithile kubona, so that ndiyandiphumela kuloo nto leyo. Ibuye ingqondo yam iphinde ingabuyi kubona still, because of why ikho ndiphazamiseka kwinto eyi-one. Nam ndifuna iisista zam endingazaziyo ukubona kule nto, like njengangoku mhlawumbi nina nalo uncedo lwento zinjalo ukubona.
Usafe kanjani tata apha esitratweni njengophila apha esitratweni? Ngibona uhamba ucela abantu imali, abanye bayaxesha, uziva njani apha esitratweni? Ufeelsha safe wena?
Like I feel safe still azizanga kubona ngifuna ukuxoxela.
Umnqono wakho dala wena Mawande umuntu obuza uba Mawande ufuna uba yintoni ngenye imini umnqono uba yintoni?
Like uphumelela kwami ukunqonela nzathi kwinto zonke ngase ndibe engineer ndiphumelele ngoku-engineer too sensitive. Ukufundeni kwami andiyazi ndandicula mos xa kodwa ke bandilahlekisa ingqondo bayithatha ihlobo lawo ukubona.
Well, that was Mawande Jacob.
Ndandicula but bayithatha ihlobo lawo ingqondo ukubona sendonzakala anyway ukubona andiyazi kodwa njani ngake mhlawumbe abanodibana nabo bantu bapha kum ukubona like bangaba bayaziyo ngempilo yami okanye lo China liyaziyo ngokustylish lilo linoyazi.
Well, that was Mawande Jacob saying that Blaine, during the time of when the regulations were still not lifted, he didn't opt to go to a shelter. He said that when he got there were so many people cramped up in a small space. And I was speaking to him earlier on, he said that he actually feared going to the shelter because in his mind, the people there had coronavirus, and he was already hearing in the news that you must have social distance. So he was asking himself, if he goes to a shelter that's going to provide refuge, but when he gets there are people lying on the floor and whom he says also have coronavirus, it's safer on the street. I asked him, Blaine, what he wants to be in the future, and he said he'd love to be an engineer. He says that every now and then he has a distortion where he's fully aware of what's going on, then times he forgets. But he's saying that beyond the streets it's not safe. Obviously right now he feels unsafe because of the various criminal elements on the street, but saying that, one day he hopes that he can go back to what he was. He used to be a singer, he used to have dreams, and one day he says he wants to become an engineer. But for now this is reality, and he says it's actually better off on the street than at the shelters.
Yeah, his struggle and many others like him in a similar predicament are highlighted, even becomes more apparent during a health crisis. And if you can't social distance, if you can't get access to water to wash your hands, if you don't have access to a mask, you can contract the virus. Each one of these in and of itself are not complete prophylaxis, but it helps in terms of spreading the virus. So that's one part of it. Talk to us about people where you are and their attitude towards homeless people, Lerato. Are you getting a sense that they have empathy for the people that are on the streets, or is there quickness to judge?
I think it's a bit of both, hey, Blaine, because we've been here for about half an hour, and I've just watching people because he was standing on the road asking for money, and there are some, who have given him large amounts of money and obviously empathetic towards him, and there are some as he comes to the window who literally just turn a blind eye and turn away. And he was saying that earlier on, that people, when you're on the street, automatically they think that you're a criminal, automatically think that you have done something wrong in society, and many people don't know the background behind people getting here. Because Mawande, when I heard his story, he said that his mom passed away and he had nowhere else to go and no one else wanted him, so he had no choice but to come to the street. So when you see people just shrugging him and just really turning a blind eye to him and being judgmental, you kind of get concerned, because if people knew sometimes the plight of the homeless people, how for some of them the street is the only option, perhaps they would be kinder. So people here, some are judgmental, but some, Blaine, it was good to see that there are still some good Samaritans.
Yeah, there are a number of factors that lead to homelessness, and we're going to bring in a number of people during the course of today to speak about some of these factors as well. Lerato, thank you very much indeed. Great reporting as always. We'll catch up with you a little later on. Lerato Fekisi there, reporting live from Port Elizabeth, highlighting the impact COVID-19 has had on the homeless. And this is our focus here on the SABC News channel today. Look, we've all felt the negative impact of COVID-19, but for the homeless youth living on the streets of Durban, the pandemic has given them an opportunity to improve their lives. They are performing a